Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanuatu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare.
Hello viewers, welcome to your favorite program, the online pregnancy school. It is always an honor and a pleasure for me to come your way with interesting topics about pregnancy and how pregnancy can be a time of joy and not anxiety or fear for the woman and her family. You know, life is like that. There are many stops on the way. But one thing is that if you know where you are going, you can always get to your destination because you use those stops as areas to guide you on the path. My name is Dr. Linda Vanuatu, and this is the online pregnancy school. Let's go for a short break. Welcome back. This program is proudly sponsored by Promise Ghana, Vanuatu International, Reverse Tap. They will serve you in a very special way when you have any program that you need to serve your people with drinks. Samzara Ventures, manufacturers of Bubble Gold liquid soap. Don't forget that we are still in the COVID season and therefore you need to continuously wash your hands under running water with soap that will wash away the dirt. It's also sponsored by Erama Clinic. And if you're looking for a place that you can have complete health care, then get in touch with them because they can even come to your home and offer you best health care. Ladies and gentlemen, there is one thing that a lot of people have heard about. People know them as things that can happen to women, but they are not sure how they all play out. Sometimes people have their own views about what brings about this particular condition and what can be done to help a woman who suffers from that particular condition. And that is why today it is a pleasure for me to have a discussion on this very important and common topic, which is called the fibroid. Now, fibroid occurs in women, but what is it? And how can we diagnose it? What should be done about it? I'm sure you would like to know more. It's a pleasure for me to introduce my guest for today, Dr. Boakye. Dr. Boakye is an obstetrician gynecologist, and I'm sure you remember the assisted delivery where we spoke about what is done to help a woman to deliver, and we talked about cesarean section. Today he's here with us again, but this time to talk about fibroids. Doc, you are most welcome.
Thank you very much for having me once again. And I'm hoping that we'll have a nice and a wonderful session once more this evening.
What are fibroids?
Very good question. Fibroids are benign tumors or growths that occur in the womb of a woman, the uterus. And I must say at this point, before we even go into details, that it's only women who can have fibroids because it's a disease of the womb, the uterus. And since women are the only ones that have the uterus, they are the only ones that can have fibroids. So they are just benign lesions of the womb of a woman. there are several types. I'm sure we'll discuss. I'll show you a few pictures where they occur and all that. And it said that it's more common in black women than in white women. If you take about 10 black women, about half of them will have fibroids. So a lot of women have fibroids. And as we go on, we'll talk about how do you know whether they have and all of that. So they are just benign tumors of the uterus, of the womb. So that's what fibroid generally is.
Okay. Doc, if you say benign, I want to understand that is it different from cancer? So what is benign for the sake of somebody who doesn't understand? And then fibroids different from cancers?
Yes. So when I say benign, it means they are not cancerous.
Okay.
So they are just an overgrowth growth of some of the cells in the uterus, the body of the uterus, and then they grow into fibroids. I must say at this point, somebody will say, well, how do we get fibroids? There are a lot of theories and research going on about the origin of fibroids, and we can't still say as yet that it is this or is that. There's monoclonal theory, a lot of theories that I don't want to delve into now. Yeah. So if usually you are asked at the clinic, so how does it happen? The only thing we'll say is that we don't know why fibroids occur, but we know some associations that we know that it's more common in black women than in Caucasian women. And it's more likely that if your family, your mother and your sisters have it, you may also have it. So there are some associations that you can have, but you cannot look at this woman and say that you, because of this and this and this, you get fibroids, or because of you have done this and this, you are going to develop fibroids. As some people will say that if you are not bleeding, it means that the blood is accumulating to form fibroids. They are all lies. They are not true. Okay. So they are benign tumors. We don't know how they really occur. The research is still ongoing, but there are associations more common in blacks than in whites.
Okay. So, Doc, if you say they are more common in blacks than in whites, is it a major problem for us in Ghana? Do we have a lot of women who have fibroids in Ghana?
A lot of women. Actually, when it comes to the gynecological surgeries, it's one of the commonest operations that we do. One of the most reasons why most women will come, apart from childbirth, coming to the hospital for operation is because of fibroids. Wow. So that is the commonest thing that we see. It's so common. It's so common.
Are they related to menstruation? As you said, some people think that the blood collects and becomes fibroid. So are fibroids related to menstruation in any way?
That is a fallacy. It's a myth. They are not related to menstruation in any way. If you don't have your menses, it means that the endometrium is not shed. So you are not going to develop fibroid. Because of this program, I got a few diagrams for you. Okay, so what you can see as I'm holding, yes. I'm holding here. Yeah. It's a picture of the uterus. Yes. Okay. And this is the middle part here is the endometrium. And that is where you usually will menstruate for the lining will be shed as menses. Yeah. So if you are not menstruating, it doesn't collect there and then be turned as fibroid. There may be other reasons why you are not menstruating that we can look into and rectify if need be. But the blood not coming is not going to collect and develop into fibroids. That is a big lie. It's not true.
Because a lot of people think that the blood will collect and become fibroid. So now we are learning. Amafo, and there's a year can have some no, kofu bebre, what's the fibroids. Na binum honadwe ye honde, sebesia ombunin sa na do hu moja na chede moja ni nyina rekọ ka gina baby na wababa ye fibroid. Nde Dr. Boachi, wache hende onsedam. Mfenyi no de kire he no, wa me ye hu baby a se obi bunin sa moja no ofiba. O moja ni opoi paado, onyaza ogina ho na kada wa te ho no wa kwaka ye fibroid. Onye dem no te. Nti no nde ye rusua nzama fa fibroid ho o sende na nkofu pi hona adwene nsi hon pi wo fibroid no hunti na nde yer ka ho asemi. Now doc, you said that the cause is not really known, but are there some people who are at risk or more likely to have fibroid? For example, is it related to age, education, socioeconomic background, or even their reproductive health, anything? Is there anything that will let somebody be more prone?
So that's how I said earlier on that it's more common in blacks than in whites. So that means that you being a black woman, your propensity for developing fibroids or having fibroids is more. You are more likely to develop fibroids than somebody who is white.
Okay.
So that is a likelihood. And then again, you come back to the family history. So that if my mother had fibroids and my sisters had fibroids, it's more likely that I may also develop fibroids than somebody whose mother didn't have fibroids or her sister didn't have fibroids. But then again, it's also possible, you see it in cases whereby the mother doesn't have fibroids, the sisters don't have fibroids, but then one of them has fibroids. So when they come to the clinic and then you ask them, does any of your sisters or your mother have fibroids? Oh, no, they don't. But I don't know why I have it. But then again, it's because sometimes people have fibroids and they don't even know they have fibroids. So if you have fibroids and you don't know you have fibroids, then you say that you don't have it. But it's the commonest disease, it's the commonest condition that we find in a woman. And I'm sure as the discussion goes on, we'll find out why some people have it, they don't know they have it, and why some people have it and they get to know they have it.
So that is what I'm going to ask now. How do they present? So that if somebody has it, the person will know.
Excellent. So to answer that, I'm going to show you another picture.
Okay.
This is a picture of the womb. Okay.
Yes.
And all the yellow ones that you see are locations of fibroids.
Oh.
So you can see that this fibroid is very big.
Yes.
Where this fibroid is linked to the body of the uterus, but it is hanging by a stalk.
Yes.
It's hanging by a stalk here, so it is pedunculated. You can see that this fibroid here, it pushes the lining of the womb a little bit up there.
Yeah.
So it distorts the endometrium. You can see that this fibroid is here. It's just in the body. It's small. It doesn't affect anything. It's just in the body sitting there. And you can see this fibroid. It is smaller than this one, but it's more dangerous because of its location. It's sitting right in the middle of the cavity. We call that a submucous fibroid. So a fibroid will present based on where it's located.
Okay.
So that if you have a fibroid that is located in the middle here, that's we call the endometrium. Usually, such a person and some of these ones will present with heavy bleeding.
Okay.
They will bleed a lot during their menses, and some of them will even bleed after the menses. They'll continue to bleed, and then the cycle continues. So every time they are having blood flow, they are never dry. So we call excessive bleeding. So all of that comes into the umbrella of abnormal uterine bleeding, and fibroids are one of the main causes of abnormal uterine bleeding. That's called AUB. When you take this fibroid here, it also pushes a little bit into the cavity, so it can also cause somebody to bleed. This particular fibroid here is sitting outside the womb, so it is not likely that this fibroid will cause you to bleed. But if it's pressing on any other organ in the body, it can cause pressure symptoms. Or if it's big, then it can make the woman's stomach become big and she presents as if she's pregnant. So there's something big in her tummy, but she's not pregnant. And so is this one. Because of its sheer size, can make the woman's tummy seem as if she's pregnant, but then she's not pregnant. So based on the location of the fibroid, then you have the symptom that the person will present with. The commonest symptom that you present is bleeding. So the woman may have her menses, and then after the menses, she'll still be bleeding, or when she has her menses, it's so heavy and they bleed with clots. And it's sad that someone will bleed with clots so much that they lose a lot of blood, and some of them actually have to be admitted in hospital to be given blood transfusion. Because they have lost so much blood that they can't even stand up and do anything. So you need to go in and then transfuse them, and then such a woman will eventually need surgery. We'll talk about the types of surgery that we'll do for fibroids when we get in there. And then one of the common other reasons why we investigate and find out about fibroids, or even do myomectomies or hysterectomies, that fibroid surgeries, as people say it, is when it comes to infertility. Because based on where the fibroid is, it can prevent you from getting pregnant. Okay. So then sometimes that's one of the common things we do. You go in and then you realize that we have this fibrosis taking over all the womb. So the tubes are blocked, everything is cutted all over the place. You can't get pregnant. We remove everything, clean it up, sew everything back together, and you get pregnant. So a woman will present, and based on the woman's symptoms, some women will present because of the sheer size of the fibroid, they urinate frequently. They can't just hold urine because the fibroid is pressing on the bladder, which is the sac that contains urine. So the bladder cannot get full. So it's like a filled balloon, but there's something pressing on it. So immediately you get small amount of urine, then you have to go and urinate. So we call the frequency. They just go to the washroom often like that. So that's what we call pressure symptoms. Okay. And then sometimes it's even so bad that it's big, and then it presses on the organ we call ureters. The ureters connect the kidney to the bladder. As the urine is formed in the kidney, then it comes down through the ureters into the bladder. So if it is blocked by pressure, by something, the urine that is supposed to flow down will not be able to come down. It will have a backflow back into the kidneys. And that's a bad thing because it can result in renal failure. It can result in kidney failure. So fibroids can present in various forms. So based on how the person presents, then we can go in and then rectify the situation based on the reproductive wishes, how old the person is, and all of that.
Okay, Doc. I think it would be good for us to show the photo again and then explain it in tree for people to know where the fibroid can be found, so that they can link it to the symptoms and the signs that can occur with fibroids.
Today, I'm making fibroid, the uterus. And to say, Besia, but when a fibroid, but a benina ain't me a fibroid because our womb may be. Now, most of that present, it depends on baby a fibroid, no. And the picture I make it as I wasn't in our hormone, I wasn't. But yellow things, no, our moon in a fibroid. And the fibroid, also, but baby a one. Or a dangerous in until be our fibroid today, or a kitty, but obey my money bleed you, or any men's or Mojan Beba sometimes, or there over hospital crown, Yaman, Moja transfusion, and son and no button. Today you don't, or outside the womb, outside the uterus, or be pressing other organs, but not causing the woman to have excessive bleeding. Another thing that can happen today. Maybe kidneys, and normal edina or filter waste from the kidney, the urine, no about blood anymore. Say or fibroid be na say or link now or connect kidney to the bladder now. And no better about kidney failure. Now no chede echo dialysis na all those things. Most of whom are not present but Baba can oh now say so me just on 10. If you are not fibroid, why you or the nurse or the second one? It's usually over clinical. Me examine or the honor me examiner. Not master be seen as a miss for Sabra. Jim, they be the oils. I can't remember. And I mean, but any there, be the whole. That is it. And that's because all my pressure on the kidney, on the bladder, will cause you to obey Johnson 10. There may be other reasons why we have that, but ever. With the what's it called, the complaint, then the doctor will also look into the complaint, do a full exam, and then we'll find out what is really causing it. And most of the time, the fibroid. Now, even though a fibroid now, we'll talk about it later. I'm sure we will. Your operation, to solve the problem based on the pede will be and pede will be, they will decide what to do for you to get rid of the fibroid so that you can have symptom free. Say emoja no to no way jai. Say something no about 10 times so now no way jai. So that is how they present at the clinic.
Doc, thank you very much. You mentioned that fibroid can be linked to infertility, or infertility can be linked to fibroid. Where specifically nessa or why obe mobi why when you infertility important but ma che hen we no da.
If a diagram here make it here. Our friend ovary. This is the ovaries. So this is where you are going to, when you ovulate, you release eggs from here. And then this is the tube. Okay, so this is the femoral end of the tube. So when you release an egg, then the egg will pass through this tube. This is the vagina. So semen from the vagina will come up here, and then it will come and meet the egg somewhere here. And that is where fertilization occurs. So after fertilization, then the embryo that is fertilized will come back and lie in the middle of this cavity. So two things. The opening of the tube, no, very tiny, something very small. You can't even see with your eyes. Hysteroscopy and able to make. If there's any fibroid today, this fibroid over harmony, if it is blocking this place, it means that it has blocked the entrance to the tubes. Even if you ovulate, the egg will come, but the sperm cannot come and meet it. And for such a woman, you can't get pregnant because there's blockage of the tubes, the tuber ostia. If there's a fibroid, that is also in here, and all that. And there's even fertilization. And then it's coming into the cavity where it's supposed to lie on a plain area like this. Then it will come and lie on something like this and autoidua. There's no way implantation can occur for such a woman to get pregnant. So you need to make sure that and like this one too has distorted the cavity. So the cavity has been distorted. And if a fertilized embryo even falls on it, it is not going to get implanted for you to be able to achieve a pregnancy. So it is either going to prevent the sperm and the egg from coming together to meet for fertilization to occur, or even after fertilization has occurred, the implantation doesn't happen, and then you have pregnancy failures, and that is what infertility is about. So that is the link between fibroids and then infertility.
Oh, interesting. Amafo, ochede se wo ho nese ebesia ebu wonse hu de moja ne bapi oyiyi nkoto ment na fie. Ko hospital na wonhwe de ebia no ye fibroid na ye beba ni treatment no do. Na wetum wahwe na wesiwa no ntam. Se wo ho nso na se bia de wonse kan waya de ehu de why dem bibi de ho a no so menfent na fie for ko hospital na wonhwe des oye fibroid na da onye bia na we hu mo beye no na wa ayeze amo na bibiara aye pepepe. This is Online Pregnancy Square. My guest for today is Dr. James Boakye. He's an obstetrician gynecologist. Let's go for a short break. Welcome back. And please remember that this program is sponsored by Promise Ghana, Vanuatu International, Reverse Tap, Samzara Ventures, and Erama Clinic. Please do business with them. And if you have any question, don't hesitate. Send me a WhatsApp message on 059 242 0625. 059 242 0625. Doc, does it mean that somebody with fibroid can become pregnant?
Oh yes, and oh yes.
Okay.
So I have a lot of women who have fibroids and they are pregnant, and they will have some of them have even had 4 or 5 children.
Okay.
So the fibroid there doesn't mean that you cannot get pregnant. in the past, probably Obi-Bano or fibroid want to go and remove it, even if for being assisted reproduction. But now, it depends on the location of the fibroids. If what I remember, there was this woman, I was preparing for surgery because not our fibroid can sick, and I won't, but we're discussing to have surgery for her. So I think the month before the surgery, then she called me that her period didn't come. And I was okay, then let's test and see. And the way she was feeling. And we tested and she was pregnant.
Wow.
So we left her and then she took the pregnancy to term. The good thing is that now, even if we wanted to do the surgery, we can even let you take the pregnancy to term so that at term, we can have a planned cesarean myomectomy. We can remove the fibroids and the baby at the same time for you.
Okay.
Or if the fibroid don't need to be removed, we leave them and then you can still have your babies once they are not causing any problems. We'll talk about it. We have fibroids that cause problems, that's symptomatic fibroids, and fibroids that don't cause problems, asymptomatic fibroids. And see, if the fibroid is there and it's not worrying anybody, it's not doing anything to you, you let sleeping dogs lie. You go and chase it. So if you're clinical, every time you know, scan, what's the way fibroid be on gynecologist or the so they'll come and then we'll assess it and then reassure them that probably why this one is not symptomatic, it's not causing any other problems. So there's no need to get rid of them, no need to go and have surgery because the definitive treatment is surgery. There are other things, embolization and that, but the main thing that we do is surgery. And I must say at this point that there is no drug that can be given to shrink fibroids. So when people go to other places, they say, oh, or fibroid, and they said, oh, but man, they drew now, or no, my fibroid, no, or best shrink it, why kitty, no. It's not true. The truth about that is that, and I don't even think that's why people talk about it like that. Sometimes when the fibroids are very big, there's some injections that we give just to try and shrink it a little bit, but we do it with surgery in mind.
Okay.
Because if you give those injections and you don't have the surgery, after 6 months, the fibroids grow back again and they become even bigger than they were before.
Okay.
So it is not a drug that we like you have fibroids and you want to get rid of it, so we'll give it to you so that you won't have surgery. Anybody who is giving you such medication is thinking about surgery. So the definitive treatment is surgical. And see, all course what to 1 minute drugs or shrink the fibroids, and that it's all not true. It's all not true. There's no drug that shrinks fibroids. The definitive treatment is surgical. And then the surgery, there's various types of surgery. Because the way it is, it's not true. All those things are geared as to on trying to, let me use the word, deceive people into buying things and doing things. There is no drug that can melt your fibroids. And you see, the sad thing is that they go around the melting fibroids, if there are really fibroids there, and they come back to us. Sometimes too, before they even tell you that you have fibroids, there are no fibroids there. Okay. So when they give you medicine and you take, and then later they say go and do a scan and there's no fibroid, then you say that, oh, I had fibroids, and then later on when I went, I didn't have fibroids. You didn't have fibroids in the first place.
Okay.
So a lot of these things are going on where women are told they have fibroids and they are put on medication, expensive one at that. Yeah. And then later on, they come and then they scan them and they say, oh, the fibroids have been melted and all that. There are all ways of getting money out of people. There's nothing like that.
Okay. If a woman comes with fibroid, what is done for her?
So as I said, when the woman comes and she has fibroids, there are two ways. The fibroids are at the top. Are the fibroids worrying you? We call it symptomatic fibroids. Are they not worrying you? We call it asymptomatic fibroids. Okay. So if the fibroid is not worrying the woman, we'll just reassure her and let her know that having a fibroid is not the end of your life. It can be there. You can live your life, and I'm sure a lot of women live life and die with their fibroids without even knowing that they have fibroids. Mm-hmm. So if it is not worrying you, we don't touch it. We don't do unnecessary surgeries for fibroids. Okay. But if it is worrying you, as in the cases that we've talked about, the bleeding, the infertility, the pressure symptoms, then we would advise for you to have them removed. And the removal, there are two types of the removal. If I got a 30-year-old lady who has fibroids and it's worrying her. So it's symptomatic, doesn't have children. So she's not, but maybe she might not even be married. The surgery that I'm going to do for her is different from surgery that I'm going to do for somebody who is about 48 and has fibroids and she's bleeding and has 4 children and does not want any more children.
Okay.
So that is how you manage them based on their reproductive wishes and then the presentation.
Okay.
So that what we do is called removing of the fibroid. We call it a myomectomy, where we cut the fibroids up from the body of the uterus, remove them all one by one, and then we sew everything back together. So that is a myomectomy. So when you do that, you leave the womb for the woman to have her children, or sometimes somebody says that, well, I've had all my children, but I don't want my womb to be removed.
Yeah.
So you leave it for them. But if the woman is 48, she's had all her children, or even 40, she's had all her children, and she has fibroids that are worrying her, she can decide that, look, I don't need my uterus anymore. I've finished having my children. I don't need my uterus. So take my uterus. And that is even fairly easy because we just go in, remove the uterus together with the fibroids, and then she's free. She's not going to bleed anymore. And then the good thing about even that, when we do that, we take away the cervix, which causes cervical cancer. So when we do that, the cervix is taken away. So your risk of cervical cancer is also taken off.
Okay.
Some women, I remember a few weeks ago, I did one for a patient, but she said she wanted the cervix intact because cervix has been shown to, some people think that it aids in the pleasure during sex. So she said, hey, I want my cervix intact, to leave my cervix for me. I said, no problem. So you do the procedure, remove the fibroids and most part of the womb and leave the cervix for them.
Okay.
So if you don't have use for the uterus, then we do a hysterectomy, a total abdominal hysterectomy, removing the fibroids and the uterus and then the cervix, and then everything is fine. But if you want to have children or you have need for your uterus, then we do a myomectomy and then we leave your womb for you. It heals up and you can have your children and do anything you want to do with it.
Hey, Doc, you said that when you open up, when you are doing a myomectomy, you remove the fibroid. Does it mean that they are like in a sac, so that when you are removing them, you don't remove the womb, part of the tissue of the womb? Are they enclosed? That when you open, you see that this is the fibroid. It is well encapsulated. There's a wall kind of around it, so you take it out without destroying the womb.
Yeah, big one. They are like noodles, and then they are on the uterus. So you cut them, you remove them out. We call that enucleation. You enucleate them, and then you close the tissues together again.
Okay.
So you open and then close. You open, remove, and then close. Open, remove, and then close. Because it is part of the uterus, but there's a line, a demarcation, where there's a limit between the fibroids and the normal uterine tissue. Okay. So you remove the fibroid and you close up the normal uterine tissue after that.
Wow.
So that's what the myomectomy is about.
So if there are 10 of them or 4 of them, when you open up, will you remove all of them at the same time? Oh,
Director, 10 or 4 is small. We've removed over 60 plus nodules.
Wow.
I know people have even removed 99 nodules.
Oh, that would take a time.
That's the thing. So it takes time and patience.
Yes.
To remove all the big ones and then the small ones. The easy fibroid surgery, the myomectomy, is one that sometimes when you open up, it's one big one like my head, and it's sitting there. So now you go and you remove it, and then you are done. But sometimes you open up, and it's plenty scattered all over the place. But you need to take your time and remove all of them, and then close them up. Because if you don't remove all of them, they will grow and become big. And if they are small ones and you leave them they will grow and become big. So you want to take your time and then remove them all. See at this juncture that sometimes there are some that are so small that probably at the time of the surgery, you might not even be able to see with your eyes. Okay. So it is possible that somebody will have a myomectomy, that's a fibroid surgery, in 5 years' time, she may have to have another one because the fibroids have grown back. So there are times that we've had people that have done the surgery for them twice or sometimes even 3 times.
Okay.
Because the surgery, the fibroids have grown back. That can also happen. And that is one of the questions that they ask. So will the fibroids grow back?
Yeah.
And the answer is that usually they won't. But whether they will grow back or not, it's only God who can tell.
Yes, Doc. Now, with removal of so many of them, can this woman become pregnant after mammectomy?
So as I said earlier on, one of the main reasons why that we even take time to remove all these fibroids is because we want to get the woman pregnant. We want to make sure that she also enjoys the childbirthing experience. So there's a way to do it, and that's why we are trained to do it in such a way that you preserve the integrity of the uterine cavity and then the uterus itself.
Okay.
So in that sense, sometimes you are plastic surgeons of the woman because you can see, and sometimes it's so nice. You open the woman up, and the fibroid is like a hydra all over the place like that, and then you take your time, you move everything, and then you close it. Then when you finish, you sit back, and then you know that why you've done something good, and it's so nice when later on this woman comes back pregnant, and you have to take the baby out for her. I remember I had a patient like that, some huge fibroids, and then we had to do the mammectomy for her, and then she got pregnant. And when I was doing the cesarean section for her, immediately I cut the woman. I removed the baby. The baby started crying. She also started crying on the table.
Oh.
So we asked her. He said, "It's tears of joy, but So those are the joyous moments. So one of the main reasons why we do the mammectomy is so that the woman can give birth again, or if they haven't given birth, they can experience childbirth."
Doc, now as we are discussing, it is possible that there is somebody who has some of the symptoms that we have spoken about and would like to come to the hospital. Are there any suggestions as to the preparations that such a woman should make? Ebi obi wo honum se oti onim se bia moje tumi a eba bebre minya me period a me bu mi nsa eba bebre na yiyi nso bibi wo ho eso ye a odi be sesie no ho ansa no waba hospital na na so ba na se mo hwe na ansa no maka chen se koye wei kodi wei ye say before the surgery is done. So what preparations go on? Yeah.
So it's a good question. So because we need to know what is happening to you, and you don't know what is happening to you, just come. Just come to the hospital and then report your symptoms. Eba more you're not abeka chain. Say based on what you are telling us, we'll know what to do. And then when we find out what it is, then it's not every woman who is bleeding like that and the fibroids are the cause.
Yeah.
There may be other causes. So then we need to investigate and find out what the cause is. And we tailor the treatment as to the cause of the problem. Yeah. So you just come to the hospital and report the symptom. Don't sit in the house and say, no, just come. And when you come together, we'll manage you because it's a two-way thing. You come and then we also help you, you help us, and then we manage you. At the end of the day, you are happy, and then we are also happy.
Ladies and gentlemen, we are talking about fibroids, and I think it's a very important topic because there are a lot of people who have a lot of misconceptions and myths. Before be brave, omo drink fibroid. Obi feel say we dey aduane bia na eba. Obi feel say owo mbu nsa na eba. Obi feel say we, obi feel say we. Bi kwa feel say obi na dey aye omo. So now we are learning, and Dr. Boachi sharing what fibroid is all about. And the good thing is that woko hospital ombe to me ahwe say symptom I would buy no is it related to fibroid. If it is, they know what to do for you. Let's go for a short break. So, Doc, now if somebody is listening to us or watching, and the person has had a mammectomy done about 5 years ago and wants to become pregnant, what should she do?
Getting pregnant, number one, it's not a simple process, but it's a simple process. Because, I mean, there are times in the hospital, the clinic. Just last week, I had a woman, she actually even has children. She doesn't have, she wants to get pregnant. So I asked her, where do you work? Where do you stay? She works in the Volta region, and the husband stays in Accra. She comes to Accra only on weekends. So she's having sex only on weekends. So she's not meeting the requirements of sex even for pregnancy.
Yeah.
Because the WHO recommends 3 times a week, at least every other day, for pregnancy to occur.
Yeah.
Do you understand? So if the myomectomy has been done and then she has been checked and then the tubes are okay and everything is fine and she's having enough adequate sex, then she should be getting pregnant. If she's not, then we are delving into infertility, where we need to go and find out why she's not getting pregnant. Is the husband's semen okay? If it's okay, are they swimming well? Is she ovulating? Because there are a lot of reasons why you will not get pregnant. That's infertility. That's another whole topic altogether. So if she's done the myomectomy, yes, I mean, is she even married? Is she even ready to have children? So that if she's doing all that and then she's not getting pregnant, then we need to investigate and find out why the pregnancy is coming. Because the fact that you've had a myomectomy is not automatic that you get pregnant. And at the end of the day, as I always tell my clients, as a pregnancy, when it comes to pregnancy, the God factor is there.
Yes.
So we will do our part, but you pray and then God blesses you with children. So you also have to do your part. We do our part. We pray to God, He does His part. And you also do your part by having the sex.
Yeah.
And that's one thing I've realized, that now, because couples work apart, that becomes a challenge. People are not living together, having enough sex. So then the pregnancy is not coming and it delays, and then they get worried. Then the stress sets in. And then the stress, we know, it's also going to compound the problem.
Exactly.
So if she's done the myomectomy, fine. Are the tubes okay after the myomectomy? We need to find out. Is the sperm okay? We need to find out. Is she having enough adequate sex? We need to find out. And then make sure that she is satisfying all those requirements. If they are there and then she's still not getting pregnant, then we delve into another topic we call assisted reproduction, where we can help her get pregnant.
Ladies and gentlemen, it means that if you were having fibroid and you had an operation done, don't just assume that because you have done that, it means you should automatically become pregnant. Please go back to the hospital, get a check with your husband, and they would assist you in any way possible. As he said, God is a factor. So as you pray, you do your part, the doctors will also do their part, and then hopefully you will become pregnant. That is, if that is what you are looking for. Doc, from what we have heard so far, what are some of the complications after myomectomy?
So the commonest complication after myomectomy, the commonest, is bleeding. Because you see, and especially this happens with the fibroids that are a lot, that you have to cut and suture a lot of places. So you need to take your time and then secure hemostasis. By that I mean that you need to take your time and close all the cavities that you have opened very well. And then make sure that after the operation, there's no bleeding point. Because that is one of the main complications of the surgery. So that is the operation part. The other complication that may be like general, in every general operation surgery, anesthetic complication and all that. But on the surgery side, bleeding is usually the most severe complication. And I must say at this juncture that in the past, they didn't have techniques and other things to minimize the amount of blood loss. But with advancement in medicine and all that, there are ways that we reduce the blood loss so that you don't lose a lot of blood during the the surgery. Actually, one of the techniques that we use, Yao 2K technique, was introduced by one of our professors, Prof. Kakume, and is used worldwide, where you tie a tourniquet and then you do the myomectomy so that the woman doesn't bleed a lot.
Okay.
It's a technique that the Ghanaian developed, and we are all using it. So that's why, in preparation for the surgery, we'll always ask you to donate blood. It's like insurance. We'll always make sure we have blood standby for the surgery. It's standard procedure. Most of the time, we'll not use the blood because we use the techniques to minimize the blood loss. But in some cases, we give the blood because then the woman's blood, she's lost a lot of blood during the procedure and the blood level is down. And then we don't want her to dip down, so we give her the blood. So by and large, the most common complication is bleeding. Sometimes, in rare occasions, people can have infection of the uterus where there may be some necrosis and all that happening there, and they may have to have a hysterectomy in the end.